Hi, everyone. Good morning, good afternoon, good evening, depending on where you're joining us in the world today. My name's Tracy Toothaker. I'm the Director of Recruiting here at Worldwide Health Staff Solutions. We are going to be talking about the University of Maryland Medical System today, which is super exciting. And also, just before we get started and get into the content that we'll be covering today, we would love to know where you're joining us from. So if you're tuning in, go ahead and let us know where you are in the world. We'd love to shout you out and take a look at who's joining in. We'd love to know where everybody is. So also, as we go along, if you have any questions, please feel free to add them in the chat as well. So I'm also joined by my partner, Megan. So Megan, I'll let you introduce yourself.
Good morning. Thanks, Tracy. My name is Megan Jenkins. I'm a recruiting coordinator here with Worldwide, and we're very excited to be here with you today to give a little bit more information about the University of Maryland.
Yeah, awesome. Thank you, Megan. Okay, well, let's go ahead and get into it. So just before we start talking about the specifics of the University of Maryland Medical System, one thing to note is the requirements for the opportunities here. It does require all nurses to have their NCLEX and then also at least 2 years of current bedside experience in the unit specialty in which you would be interviewing for. So those are kind of the two main requirements that we wanted to highlight. And then next, just in addition to those requirements, all of our worldwide health staff opportunities, RN opportunities are, there are direct hire opportunities, and we also assist with processing. Specifically within immigration, you will be interviewing and obtaining an EB3 visa, which is a green card as you transition here to the United States. All of your immediate family members are included at no extra cost when processing, and then there's also no English exam required for processing as well. We will provide reimbursement of the healthcare worker certificate, which you may know this as the visa screen. It's commonly referred to as such, and then also reimbursement for the medical exam. And then when you are arriving to the United States, we provide airfare to the United States for you, and then at least 30 days of housing at minimum as you transition to get settled here in the United States. So that's kind of an overview of the offerings that we provide for all of the opportunities in which we're hiring for. Okay, so now we'll get into the University of Maryland Medical System. So as you can see here, the picture provided is their main campus in downtown Baltimore, Maryland, which actually, if some of you were joining us, Megan and myself, a few weeks ago when we covered the state of Maryland on our last webinar, you probably heard us talk a little bit about that. And so Megan and I had the opportunity to actually go to Baltimore and visit this particular facility, a little earlier this year, a few months ago. So we'll talk more about that here soon. So the University of Maryland Medical System is a comprehensive nonprofit healthcare system. They serve Maryland and surrounding communities. They're committed to providing high quality, personalized healthcare and advancing medical research and education. They're focused on improving the health and well-being of the diverse populations that they serve through innovative care and community partnerships. They also support public policies that enhance patient care, promote health quality or health equity, and ensure affordable healthcare access. So that's an overview of the medical system. Okay, so their mission is to purposefully advance the shared principles that are foundational to their network, which are compassionate, high-quality care, commitment to community, healthcare transformation, and discovery-based medicine. Their vision is to build upon their tradition of excellence in patient care and innovation to be a national leader in the transformation of healthcare. And then their values are listed as compassion, discovery, excellence, diversity, and integrity. Awesome. Okay. So I know I mentioned that Megan and I had the chance to actually visit and kind of see not only just the downtown facility, but some others, which we'll get to in a minute. But I'm going to pass the baton to Megan to go over some of the numbers and the next few slides.
Thank you so much, Tracy. So just wanted to give a few statistics about the University of Maryland medical system, and just to give you a general overview of some information about them. The university itself has about 17,778 admissions a year. And the hospital has about 307 licensed beds. They employ about 3,059 people, and of that number, 1,200 of them are medical staff. Yearly, they see about 264,000 patients, and of that, about 66,000 is going to be emergency visits. And yearly, they do about 12,000 surgeries, and they also welcome about 1,800 babies into the University of Maryland every year. So that is very exciting. All right. So, a little bit more information about the position itself. Some of the requirements, they do require a Bachelor of Nursing degree and about 2 years of current bedside experience in order to qualify for this opportunity. Some of the benefits that they offer are a $1,000 sign on bonus, and they also provide a $2,500 housing allowance or 30 days of temporary housing. Some of our worldwide benefits are you do receive reimbursements for the healthcare worker certificate and also your medical screening during the immigration process. We do have some current openings for the University of Maryland at their Bel Air location in the Med-Surg Telemetry Department. So you should definitely ask your recruiter about more information about that opportunity.
One other thing I was going to mention just really quick, Megan, and I know that we have, active schedules for the Telemetry Bel Air location, but just wanted to also call out that we will very soon have additional opportunities at another facility within the medical system, about 45 minutes south of DC. So, I know that wasn't listed necessarily on the slide, but I did want to call that out in case anyone is interested in some other opportunities at other locations too.
Absolutely, absolutely. Some of the benefits that the University of Maryland offers are medical, dental, and vision. They also offer a life and disability insurance as well as an employee assistance program. Through their medical insurance, they also both have a flexible spending plan, as well as retirement savings accounts as well. Because they are a university medical center, they do offer tuition reimbursement as well as educational assistance in addition to paid time off. So, some great benefits there as an employee of the University of Maryland. All right, so a little bit more about life in Maryland. Some great reasons to move to Maryland. It is a very historic state. They have very charming small towns and a lot of history. So if you love history, I would definitely recommend Maryland. They are also very cultured in the arts, um, as well as access to beach, parks, and nature. A lot of historic parks there as well for you. They have wonderful, wonderful, wonderful seafood and dining. Me and Tracy got to experience that a little bit when we were there earlier this year, as well as some top rated schools and universities. Maryland is known for being very safe and family friendly to all that move there or live there. And it is also very convenient and accessible to nearby major cities. As Tracy just said, it's very easy to get to DC. It's anywhere from about an hour to 45 minutes, depending where you are in the state. Also, very close to New York and Philadelphia. Those are within 1 to 2 hours of Maryland as well. And they also have a very strong sense of community in Maryland. Some quick facts about them. The state population is going to be about 6.3 million. The median age of people who live in Maryland is about 38.9, and the average commute time is about 31 minutes. The median home price is going to be about, and I think we might be off by a number there. I'm going to say 300,000,
I think you're right.
333,000. And the average temperature in Maryland varies from about 87 on the high end to 27 on the low end. Average rainfall, they get about 44 inches of rain a year. The average rent price in Maryland is going to be a little bit over 1,600. And one of their major airports is BWI, which is located in Baltimore. All right, so a little bit more about the cost of living in Maryland. We have a couple comparisons here from a couple different cities in Maryland as compared to San Francisco. As you can see by this chart here, the price of living in Maryland is very much lower than it would be to live in California, which gives you a much more affordable option. Average cost of housing monthly is going to be a little bit under 2,000, anywhere from about 1910 to about 1945 a month. The average cost of food will be a little bit over 1,000 as well. And childcare is going to be a little bit over 2,000. So anywhere from 2,200 to $2,100 for childcare, depending on what city you live in Maryland, and what options that they offer. For transportation, it's going to be about $1,600 a month. That can include anything from public transportation to Ubers, to maybe renting a scooter or biking, just whatever type of transportation that you choose to use, and commuting to and from work. The average cost of healthcare in the state of Maryland is going to be $1,092 a month is about the average. And other necessities, which may be anything from food, utility costs, things of that nature, is going to be a little bit over $1,000 a month. The average taxes that residents see in Maryland is going to be about $1,600 a month as well. So definitely some things that I would advise looking at as you're exploring the state of Maryland. Again, these are just some rough estimates, but it all depends on some of the options you select in moving to the state of Maryland. All right. So, as Tracy gave a little bit more information, we will be recruiting for our Bel Air location for the University of Maryland in November, at the beginning of November on the 7th and the 10th. This is definitely an opportunity that you should take advantage of if you're interested. Feel free to reach out to your recruiter, and they will be able to let you know if you qualify to be able to be scheduled for an interview. We also have a few other locations that will be coming on board with us as well. That'll be in other parts of Maryland, some in the DC location, or just around the state of Maryland as well, that we're very excited for. So definitely keep your ears out. Stay in contact with your recruiter, as we would love to have you guys apply and interview with the University of Maryland.
Awesome. Yeah, thank you so much, Megan. One other thing, excuse me, that I was going to call out to is, I think Megan and I have had the opportunity to be in the area in a couple of different seasons, and so one thing that's kind of neat about the state of Maryland is, you'll see snow in the winter, not in the debilitating way. It kind of came fast, left fast, so it was fun to see. But then they have really great summers too. They're, right near the Chesapeake Bay, and have a beautiful kind of water community and great seafood, like Megan mentioned. So, you get kind of truly all four seasons, and really get to see the fun part of winter, which is snow. So we got to experience that firsthand. It was really neat.
I would agree. I would agree. As Tracy said, we got to see it throughout a variety of seasons. The snow was very beautiful, but also very manageable as well. It was still very easy to navigate around, even when it was snowing. In the warmer seasons, the bay is very beautiful. And they have, like we said, a bunch of small towns that are beautiful as well to experience at the bay.
Yeah, definitely. And just being there, we've been to a couple of different locations within the medical system, and one thing that's consistent is the people are so great, really diverse communities, and just have all walks of life there, really knowledgeable, and just supportive community, not only in the hospital, but obviously just in the surrounding cities too. So really great opportunities. We're excited that we have the chance to recruit for them again like we did earlier this year. So happy to highlight the medical system overall.
Absolutely.
Okay. All right. So we can start to take a look at the chat here and address any questions. We'd love to hear from you. So please ask away if you have any questions for us specifically about the University of Maryland opportunities. You can drop them in the chat. And then also, if you are wanting to connect directly with our recruiters who are standing by live in our live chat, we'll drop the link in the chat for that as well. All right, so starting from the bottom here, looks like, oh, very cool. We've got somebody from St. Lucia. Hello, Phyllis. Chatting from Maryland, perhaps? Someone from Maryland? Very cool. Kuwait, hello. Awesome. Hi from the UK, Nigeria. Amazing. Love it. Very cool. Okay, so like I'm seeing some questions just about what the opportunities look like. So the offering that we have currently for the University of Maryland are RN EB3 opportunities. And so I think there's a question about if you are in Maryland and trained internationally, can you apply? I think that might look like a little bit of a different pathway for you specifically as it relates to these opportunities, but we are happy to help and engage in those conversations with you to see what we can do to help. So if you have not already applied directly through our website, please do so. We'd love the chance to talk through, how we can help. Hi from Germany, the Philippines, KSA, hello. Yeah, so I know question about cost of living, and absolutely, I know, we covered a little bit of those specifics a couple of slides ago. Thank you. Yes, so as you can see here, here's some cost comparison from the county in which we have the opportunities within Maryland against, just for example, San Francisco, which is, obviously, quite a vast difference. San Francisco's cost of living is much higher than the surrounding, really the state of Maryland, period, but especially the areas in which we're recruiting for. And so this comparison here shows 2 adults, 2 children in Charles County, and then also in Harford County. And so as you can see, kind of all in, it's right around that 126, 127,000 a year, given, obviously this, give or take some, depending on the scenario where you live, some of the choices within transportation, childcare, food, you name it. But that gives you kind of an idea of what to anticipate or expect if you choose this location. Question about medical technologists. So as it relates to the University of Maryland medical system, we do not currently have any medical technologist opportunities, but that's not to say that we don't have those at all. Happy to talk to you about what those opportunities look like, Patrick. If you'd like to apply directly, we would love to help. And then an ICU position available. So for the opportunities that we're recruiting for right this moment within the University of Maryland, no, we're specifically looking for med-surg telemetry nurses. However, we anticipate that could very well be a unit in which we're hiring for within the medical system at some point in the future. So would love to talk to you about what those opportunities look like or other ICU opportunities that we might have. Okay, let's see what else we got here. Am I missing anything, Megan?
I don't think so. I think we might have hit all the questions.
Okay. Oh, okay. Tuning in from Kenya. Hello. Interested in working with us? That's amazing. We would love to work with you too. Pluto David, if you want to go ahead and apply, our host has dropped our website link in the chat just now. That's a direct link that will take you to the application for you to submit your details, and a recruiter will be in touch with you very soon. From the UK. Amazing. Yep, opportunities for postgraduate studies. I think, obviously we would love to have a conversation with you about your scenario and specific qualifications. I think, we offer various RN opportunities, healthcare professional opportunities, and so once you get through schooling and obtain the necessary certifications, we would love to have a conversation. So yeah, please go ahead and apply. Okay. Question about caregivers. Yes, we can have a discussion about that as well. We support several different long-term care facilities and skilled nursing facilities with all types of specialty nurses. So happy to chat about that as well. Okay. All right. Well, if I know we'll give it a couple more seconds to see if any additional questions come in. But in the meantime, whether you're already engaged with us or are looking to work with us and may also have a friend or two that would like to join your journey to the United States, wanted to call out our Refer a Nurse program. And you can earn $250 for each nurse that you refer. So we'll drop that link also in the chat for you to be able to refer a nurse. Okay. Question about safety in the area of Maryland. So, obviously, Megan and I were actually in both Baltimore, Maryland, and then also in a couple of the smaller suburbs of Maryland as well, both Bel Air and Easton. And at no point in time did we ever not feel safe. As you can imagine, some of the more densely populated metropolitan cities, whether it be Baltimore or really anywhere else, may have, if you go and look, may have higher crime rates just because of obviously the number of population. But again, very safe city, and we never at once felt like that was a threat to us by any means. Spent a lot of time there, and also validated that through several of the staff nurses and other faculty as well. They have great security on site and on campus for the hospitals in which we visited. And so they take that very seriously.
Absolutely.
Tanzania, amazing. Welcome. Question about opportunities for CNAs at the University of Maryland. Not currently. The opportunities that we're hiring for are RN opportunities. So at the moment, that's what we're supporting for them. Oh no, looks like there might be an error about our chat page. So maybe we'll have our host look into that while we're talking. In the meantime, Mary Joy, I think we could add an email address. Maybe if you want to reach out to recruiting@healthstaff.org, we will be happy to get in touch with you that way. From Ethiopia, welcome. Question about offering NCLEX sponsoring. So we have several resources to help you prepare for the NCLEX. We, however, do not sponsor the NCLEX. And so that's something that you would need to obtain and take on your own. But we have a wealth of resources that can help you prepare for that we're happy to share. From Nigeria, amazing. Yep, and then Mary Joy, I saw your question. Our host just put a direct email in the chat that feel free to reach out to. We'll be on the lookout for that. We can schedule something. Thank you so much for thinking of us and for sharing that opportunity with us. We appreciate it. Okay. All right. So also, we would love for you to connect with us. So we're on Facebook, YouTube, Instagram, and then of course we have our direct site where you can apply to. So we'll add our direct links to follow us on Facebook and like us. Follow us on YouTube. We've got not only this webinar will be posted on YouTube, but several others that we host frequently about all kinds of topics, both opportunities and immigration updates. So would love for you to interact with us there. And then follow us on Instagram. We're always posting fun things there too. And of course, if you are interested in applying directly, you can reach us at healthstaff.org. Okay. All right, Megan, anything else that you can think of before we close out?
Nothing else on my end. Just wanted to thank you guys again for joining us this morning. We've had a great time answering your questions and giving you guys a little bit more information about the University of Maryland.